Okay, so organ dysfunction. Common organs that have dysfunction, like I mentioned, is the colon. A leading cause of constipation issues is not enough iodine. It's really important. Low thyroid gland. Another organ issue that you heard when I talked about those different prescriptions are lungs. The common cause of lung problem is sugar. Sugar is devastating. Haven't you figured that out? Sugar will affect your lungs. But you know what else I've seen affect lungs? Is citrus. Orange. And I'm not telling you not to eat these, but I have seen people have chronic lung problems because of citrus. Okay, and there's other, we can talk about organ problems all day long. There's a lot of different kind of organs. That's not the purpose. The purpose is to make you think. So what can you do to prevent needing a medication? One of the most common medications that people come into my office that they're taking are high blood pressure medications. I would make this suggestion to you. Drink more water. A lot of times people's blood pressure goes up because they don't have enough water in their body and their blood is too thick. Another suggestion that I think you might want to try is 2 ounces a day, ounce in the morning and ounce at night, is pomegranate juice. Pomegranate juice. Another one is mung beans. Now I'll give you the recipe about mung beans. You can take an ounce of mung beans and put it in hot water in the morning. Ounce of mung beans, put it in hot water in the morning. Let them soak for a few minutes. Drink the water. Then put more water in it, and at noon you repeat the process, but you just drink the water that's been in the mung beans all morning. Put more water in it at noon, and at dinner time you drink the water and you eat the beans. I've had people's blood pressure go down because of mung beans. I learned that when I was doing my Doctor of Natural Health studies. And finally, when it comes to blood pressure, avoid sugar. Sugar will raise insulin. Insulin causes sodium retention. Sodium retention will cause high blood pressure. And if you go to my webpage, www.druglessdoctor.com, I have a video from ABC News on there that talks about the chiropractic adjustment that I do in my office will lower your blood pressure up to 20 points. And I've had patients in here, it doesn't do magic for everybody, but I've had patients' blood pressure lower 20 or 30 points with the adjustment alone. So blood pressure is one common one. We already briefly talked about what raises cholesterol and how you can help eliminate that. Apple, beets, and carrots. Half an apple every day. Red apple, not green. Beet fiber, and if you go once again to my webpage, I don't know how many of you have been to the webpage and saw, you can watch how I cook beets on the webpage. You can learn how to cook your beets. Have a third a cup of beets every day, and finally some baby carrots. So that's how you get rid of cholesterol issue. And finally, for depression, people who are depressed oftentimes have a low thyroid gland. They need tyrosine. They often have a low thyroid gland, but they need tyrosine. And we determine that by TSH, T3, and T4. We also encourage our patients to use flax oil. A tablespoon of flax oil every day per 100 pounds is awesome. What are the side effects of medication from? Now the difference between side effects and bad effects is marketing. All effects from medication are really bad effects. You know, you watch television, my gosh, you have you take this one lung drug that you're going to take, and one of them even says it may cause death. I'm thinking to myself, why in the world would someone take something that causes death? And another one that you're taking for digestive distress can cause you bleeding from your rectum, you might throw up, you might have abdominal pain. I'm thinking, do they think like we are stupid? But you know what? We are. Because people are taking all kinds of medications. Now I'm going to tell you some really scary statistics. Are you ready? I just love this. One drug has 10 bad effects. You got that? Now drugs interact exponentially. 2 drugs have, when you combine them, so you have 10 and 10, it's not added, it's exponentially. 2 drugs cause 100 bad effects. So you're taking 2 medications, 100 bad effects. If you take 3, it's 1,000. If you take 4, it's 10,000. 5 is 100,000. 6 is 1,000,000. 7 is 10 million. 8 is 100 million. 9 is 1 billion. I have people that have come into my office as a new patient that are taking 9 medications or more every day that's causing 1 billion reactions. Now listen to me. Recently they had a famous movie star or a movie star that died of something called polypharmacy. You're going to hear that buzz. And it's hard to get people off of this polypharmacy. You know, I had a lady that came to us the other day as a new patient. They injected her knees with some kind of silicone gel. And side note, eggs, onion, and garlic. You want to keep your joints going good? Eggs, onion, and garlic. Eggs, onion, and garlic are a great source of sulfur. So they injected her knee, and guess what happened to her? She became, she had ulcerative colitis as a reaction to that injection. But it gets better than that. I'm being silly right now. She became a diabetic after that. And then they ended up doing a knee replacement. Should have been better off not having them do anything. It's amazing. I've had patients come in the office with digestive distress. They gave them a drug for the, they had to give them a drug for something else. They gave them a drug for this, which caused, they had to get depression. It was just, it's mind-boggling. So medications trick your body. Anytime they trick your body, they cause a bad effect. One of the worst medications in the whole world is a medication for your heart, for blood pressure, because it weakens heart muscle. One of the leading causes of heart disease, congestive heart failure, are the prescription medications that people are taking. And by the way, we encourage Cataplex B. Cataplex B as in boy is important for heart health. Now, what is the liver's role of detoxification? And this is critical, because I also read an article in one of the major newspapers that teenagers today, young kids today, are becoming vegetarians. I don't believe that anybody should be a vegetarian. You need animal protein, and why you need animal protein is for this reason. There's a system in your liver called P450. P450 is how your liver detoxifies. There's phase 1 and phase 2. When you take chemicals in your body, your liver goes through phase 1. Guess what it needs? Protein. It needs animal protein. Your body takes toxic chemicals and it makes them water soluble. That's why people have liver disease and kidney disease. So you want to eat animal protein. 3-ounce to 5-ounce servings as often as you can during the day. If you eat protein and you crave sugar, you're eating too much protein. Animal protein, chicken, fish, turkey. I prefer ground turkey or turkey thighs. That's a good source of fat. There's some great recipes on the webpage. So your liver, you want to make sure that you are taking some kind of liver cleanser every day. I personally take dandelion root every day. We have a product called Livoplex, Hepatrophin, Livotrit. You can just ask me, we'll show you. But I would encourage you to start thinking about taking them. And when we get to that certain part in your treatment program, we'll make those available to you. But dandelion root is the one I use. Livoplex. Livoplex. You can take one a day. I'm just telling you, I talked to a lady in New York because I consult with people all over the world. And she said to me, I said, do you have red cherry hemangiomas on the body? And she said, no, but I have beauty marks. Well, beauty marks are not beauty marks. Beauty marks are moles that come from your liver. But you see how we twisted that around? Are you getting to the cause of your problem with prescriptions? When you are taking prescription medication, you are not getting to the cause of the problem. That's really, really important for you to get that. You could take a prescription medication for a woman to stop having urinary incontinence. That means peeing your pants, and it causes dry eyes or dry mouth. Or you could take an antihistamine. See, antihistamine means it's taken histamine out of your body, but the histamine is there because your body's having a toxic response to something. So we use a natural product in our office called Antranex, but one of the most common reasons that you could have histamine is because you have an allergy. So I'm going to flip you all, even you, all you patients, go to my webpage, www.druglessdoctor.com, and watch the program I just did on allergies. The leading cause of allergies happens to be poor fat metabolism. Okay, so how can you strengthen your immune system? Well, the number one way to strengthen your immune system is not to eat sugar. Because if you eat sugar, you're going to be stressing your immune system out totally. A couple other thoughts besides not eating the sugar is because sugar will stress your immune system out. You want to drink more water. Just water. Because see, water is going to help purify the system. Can I tell you, one of the best sources of vitamin C is red peppers, yellow peppers, and orange peppers. I would rather have you not eat citrus, but eat red peppers, yellow peppers, and orange peppers. Great source of vitamin C. Vitamin C will help your immune system an awful lot. And you know what? Finally, what you can do is I have found that people need more calcium. Calcium lactate. Calcium lactate helps hold cell membranes together in your body. And you don't want to have those cell membranes fall apart. You have a greater chance to get a virus. You have a greater chance to catch colds. Okay, you're going to have more lung problems if you don't have enough calcium. Calcium lactate, empty stomach, add extra sesame seeds, add almonds to your life, and make sure that you eat some greens. That'll help. And then we'll come back and I'm going to close with other